Tatamagoush comes from the Mi'kmaq word Tuckamagush, which means the meeting of the waters, and the community exists on the ancestral and unceded territory of the Mi'kma'ki people. The name itself shows the long cultural and colonial history and the importance of the waters to the Aboriginal people, who used the waterways to travel from PEI to the southern parts of Nova Scotia. The village is located on the Northumberland Strait, 50 kilometers north of Truro, where the Wa and the French rivers meet. The town is comprised mostly of colonial settlers, some coming from the Acadians dating back to the 1700s. Most of the historical industry in the area has been focused on resource development such as shipbuilding, lumbering, mining, fishing, and forestry. Upon first arriving in the village, people will see the Welcome to Tatamagoush sign. This highlights the warm maritime nature and the friendly attitudes of the community, which was further demonstrated by our interactions with the people in the village. There are many green spaces, vegetation, agricultural areas, and of course the rivers. Through this project, we have come to learn that the water is a key natural element to the physical, mental, and spiritual well-being of the community and its members. The village has many local shops and new businesses, while much of the housing is single dwellings with very few apartment buildings. All the buildings in the area seem to be well cared for and in good shape. Tatamagoush seems to have an atmosphere filled with tolerance and excitement for newcomers and visitors. And since it's a small community, people seem to know each other very well, maintaining close relationships. Overall, Tatamagoush was observed as being vibrant with active engagement by youth, adults, and seniors. As you can see here on this slide, most of the population has an annual household income of less than $40,000, some of which comes from those government transfers. Tatamagoush is a community with a small population and a large number of older adults. We have learned from community members that the village tends to attract many baby boomers from other provinces across Canada who are looking to spend their retirement in the friendly and relaxing setting that Tatamagoush provides. Although the village is financially poor, we have found it holds a lot of social and cultural capital. Recreation and leisure pursuits provide opportunities for socialization, physical activity, and cognitive stimulation. Tatamagoush offers a wide variety of recreation facilities and programming, such as the North Shore Recreation Centre, which is home to activities such as figure skating, hockey, and fitness. There is also the Tatamagoush Centre, which is used for social justice workshops and spiritual retreats. There is a yoga group in the area, and just outside the village is the Dorje Dema Ling, which is a retreat center offering different programs related to creating good society. There is also an active seniors association, the North Shore Archives, and of course the outdoor trail system. These recreation facilities hold a place for community members to meet and communicate concerns, obtain information on particular services, or hear about local events. Another source of communication within the community is a Facebook group called What's Going On in Tatamagoush, Nova Scotia. This serves as a resource for the community to pose questions or share information. Additionally, the community newspaper, the Tatamagoush Light, serves as a source of news and communication for the village. Community members use these resources to develop a shared identity. As Parada, Barnoff, Moffat, and Holman point out in 2011, the shared feelings about the environment and the betterment of the community empowers the local residents. Villagers are constantly striving to improve conditions as much as they can. They have a great sense of value for their community. The natural resources and environment of Tatamagoush are incredible assets and sustain community capital. For example, the Trans-Canada Trail is used in all seasons by walkers, runners, cyclists, and ATVers. The trail runs along the Wa River and provides an area for picnic sites and scenery for local residents and tourists. Tatamagoush's environment plays a major role in the seasonal tourism industry. Tatamagoush has human development capital which is fostered through the skills and experiences of older community members who act as strong leaders and volunteers. The community also has many talented artists and musicians, and there is a local farmers market. The collectiveness and cohesiveness demonstrated by the members of the community are also an asset. The community has a strong volunteer presence, indicating great social and emotional capital. Organizations such as the Tatamagoush Centre and the North Shore Recreation Centre have dedicated, enthusiastic, and productive volunteers. Another big asset in the community is the business sector. Despite the village's small size, there are a huge variety of services and products, many of which are still fairly new and have been started by younger folks moving to or returning to the community. Additionally, the presence of a hospital in the community of 755 people is a huge asset. There are internal and external challenges within the community of Tatamagoush. The village is facing the possibility of gold exploration and mining, which could threaten the local watershed. There is community resistance, with many villagers displaying "Water Not Gold" signs on their front lawns and in their windows. Tatamagouche also doesn't have a reliable public transportation system, making it difficult for those without cars to access needed services and resources. Finally, the village's local hospital is facing staff shortages and burnout, resulting in increased wait times, emergency room closures, and community members waiting more than 5 years on a waitlist for a family physician. We have decided to focus on providing 2 macro solutions to the healthcare crisis in Tatamagouche. We developed our macro interventions through researching the community in the media, by interviewing local leaders via telephone, and by visiting the village and speaking with community members directly. On Saturday, November 10th, we conducted interviews in the community to gain knowledge and perspective on how the residents felt. Alex Ross and Mary McCauley, both local business owners whom reside in Tatamagouche, spoke about challenges in their community. Next, you will see a video interview completed by our group which captures some of their thoughts.
I'm from Tatamagouche, Nova Scotia. I was born here and have lived here for most of my life.
Where am I from? I'm based here in Tatamagouche.
I haven't personally had a doctor for I think maybe 4 years now. I've been on a wait list. And so anything trivial, we need to go up to the ER for if it's open. My father is ill. My partner's father is also ill. He took a stroke just in the last few months, and the entire process of going to our hospital, which was inadequate, to Truro, which is then again inadequate, to Halifax waiting for ambulances, like if he'd been able to be treated sooner than later, it could have made a huge difference. And I'm worried about my father. Like, we had to rush him over to Truro last year because he started having trouble breathing. And like, that's just, it's scary to think about, that there's things that people in this community could likely die from that would be avoidable with a better functioning hospital.
Well, the one thing that I think would be really a good idea is if we had some kind of a transportation service in between Truro and Tatamagouche that was via the hospital. It is necessary because we do have the mountains and quite a long stretch of road if you go along the North Shore either way. So Tatamagouche is quite central for quite a large number of people that require health services.
I think we have a great healthcare system, especially compared to other parts of the world, clearly. But I think they need to pay more attention to these smaller rural hospitals and communities and do something to attract more doctors, just something. I don't know where you'd find the money. Like, that's always the question. But
We chose to focus on the healthcare crisis in Tatamagouche as the community is in dire need of a solution. The mining challenge already has a well-mobilized and organized effort, and the transportation challenges proved to be too large of an issue to propose a viable solution. The Lillian Fraser Memorial Hospital was part of the Colchester East Hants Health Authority until April 2015, when Nova Scotia amalgamated the 9 provincial health authorities into one, the Nova Scotia Health Authority. The province claimed they had launched a new health system structure to create a foundation for better health and better health care. The CEC at the Lillian Fraser Memorial Hospital has 10 acute beds and allows community members to access clinics, x-rays, emergency services, inpatient services, and outpatient services when physicians are available. Our grounding for our social work macro interventions come from empowerment and systems theories. We developed our macro interventions through research and content derived from the work of Parada, Barnoff, Moffat, and Holman in their texts Promoting Community Change, and Malcolm Payne's text on modern social work theory. Through connecting community stakeholders and building their capacity, we are engaging with empowerment theory and system theory as they relate to social work practice. Advocacy and empowerment are connected with self-help and individuals and communities participating in decisions that affect them. Using empowerment theory and intervention with the community members of Tatamagouche allows us to help them help themselves. The process of creating communication connections and working groups builds the capacity of the community and helps the community members take power in this crisis. By increasing their ability to engage in social democratic practices, we are helping to enable them to overcome their barriers. Systems theory emphasizes the interconnectedness of all aspects of a community. From an individual to a street to a neighborhood to a town, each aspect works together as a set of systems to create balance and community health. Systems theory rests on the assumption that when one part of the system changes, it will always have an impact on the system overall. The application of systems theory helps us to understand how changes on a policy level can have a significant impact on an individual level and how problems outside of the community can affect community health. Though Tatamagouche is vibrant and a healthy town, external systems do have the potential to significantly upset the equilibrium of the community. Like many smaller communities in Nova Scotia, Tatamagouche is facing a healthcare crisis. A growing concern is emergency department closures at the Lillian Fraser Memorial Hospital and a lack of family physicians. Staff shortages result in both a risk to community health and a risk of staff burnout. As you can see here on this slide, the rolling closure of the ER for the past 2.5 years is due to staffing shortages. Many community members are on a 5-year waitlist for a family doctor, and this points to a community in dire need of physicians. Across Canada, there are challenges to recruitment. However, there is an advocacy movement for labor flexibility among physicians between the 29 jurisdictions in Canada and internationally. When applying for a license to practice in Nova Scotia, training in the 29 jurisdictions does not ensure eligibility. The physician's training must be assessed by the Royal College to confirm satisfactory healthcare standards. Then the physician is eligible to take Royal College certifications exams for licensing in the province. As a result of the lengthy licensing processes, doctors often do not receive licensing in time to cover vacant positions. Our first macro intervention is focused on policy advocacy to alleviate physician shortage. We want to support the community through community discussion and cultivating collective action. There are currently a limited number of family physicians in Tatamagouche, resulting in community members needing to use the emergency services to fill prescriptions and other basic healthcare needs. We are suggesting the following steps be taken. Arrange a monthly town council meeting focused on healthcare. These will be open to the public, and community members will be invited to address their experiences and concerns regarding the healthcare crisis. Notification will be posted on the following: the Village of Tatamagouche website, Municipality of the County of Colchester newspaper, and the What's Going On in Tatamagouche, Nova Scotia Facebook page. Stakeholders in the community will be invited to sit on a panel. This includes local pharmacies, Nova Scotia Health Authority, Doctors of Nova Scotia, and the Lillian Fraser Memorial Hospital staff. To increase collective action, the community should re-establish the Northern Community Health Board, the CHB. The CHB works with the Nova Scotia Health Authority in addressing the health needs of the community. We recommend the community develops a local healthcare crisis working group. This group will actively work to advocate on behalf of the community to the Nova Scotia Health Authority by gaining representation on the Nova Scotia Health Coalition, the Nova Scotia Health Authority Patient, Family and Public Advisory Council, and the Volunteer Advisory Committee. Rothman suggests in the reading from 2007, participation and engagement permit the community to operate within the internal health system. It also provides access to valuable advisors who can provide insights or technical information regarding the Nova Scotia Health Authority's advancements in addressing the physician shortage and changes to licensing practices. Our core text from Parada et al. Also suggests this will help connect communities experiencing similar healthcare crises, allowing them to create a unified voice. Engagement in provincial health coalitions, councils, and advisories work to empower community members by involving them in systemic change. By participating at this level of macro interventions, they are not only working to meet the needs of their community, but also impacting larger health policies in the province. As a result of the CEC circle of care being broken, frequent staff shortages result in heavier workloads for the few available staff, further leading to community members going longer with unaddressed health issues, which results in complexities and the presentation of several issues at once. The broken circle of care means longer days, heavier caseloads, and more administrative tasks, resulting in staff burnout. It is a cyclical issue. It cannot be fixed with looking at the job as a problem. Rather, as Montgomery suggests in a reading from 2014 focusing on healthcare issues and staff burnout, a systemic redesign is required. A 2017 study by Dr. Leader with Doctors Nova Scotia compares data on healthcare providers with other reference points, the 2017 Maslach Burnout Inventory and the 2015 Areas of Work-Life Scale. It also compared results to data from the CMA's 2008 Canadian Physician Health Survey. The following emerge as distinct issues for Nova Scotia: Physicians are struggling to manage workload. They are also having challenges with exhaustion, cynicism, and efficacy, and their results were significantly more negative than relevant norms. There's also a specific strain related to both cynicism and low efficacy pertaining to physicians' perception of lack of respect for their professional expertise and autonomy. Dealing with this is a challenge. Our current healthcare system is built as a fee-for-service model, where physicians are compensated for one service per visit, despite having to address more than one need, leaving physicians to choose to deny services or provide it without compensation. The system is patient care focused, and there's a lack of attention on supporting physicians to be able to better manage and cope with their workloads. To address physician burnout, a capacity-centered approach is being taken for the empowerment of people and communities, energizing them to act competently on their own behalf in determining goals and taking civic action. The primary focus of this approach is to build social competency of how community members can help to prevent overuse of CEC services in the community by providing education on proper use of services as well as other medical resources in the community, thus alleviating some of the workload placed on local physicians. The goal here is to support community cohesion of health services and to increase the community's overall health-related competencies. It is important to bring together healthcare providers, such as pharmacists, nurses, physicians, and first responders to roundtable discussions which focuses on their capabilities and services to identify pressure points related to CEC walk-ins. For example, pharmacies can provide flu shots, minor assessment during cold and flu season, and can process some prescription renewals without the patient having to see a physician. It is also important to help community members create a community education program which increases community members' knowledge of health services and helps to develop their skills in the proper use of the community's internal health resource. This allows them to know when to seek care outside of the community. The education program would be communicated through engagement in community meetings and through advertising in print, radio, and social media. Fostering a collective educational approach to the use of medical services empowers community members by providing them with the ability to self-assess where they should go to address their healthcare needs before presenting at the CEC. This also harmonizes the circle of care in the whole community versus simply relying on the hospital. It also works to invite all community members and stakeholders to work towards creating a healthy community collective. Tatamagouche is a vibrant community, one which possesses several assets, from the vast network of nature trails and its growing economic center to its strong sense of community. The village is poised to make impactful, positive community change. Like most communities, there are internal and external factors which lead to challenges, but there are also assets which can be leveraged to the benefit of the community and the province. Our community assessment found that the residents have the capacity to mobilize and advocate for themselves with a united voice. This was observed in the community spirit and ability to oppose the gold mining industry. However, there were gaps identified in the cohesion and interconnectedness of the village. Interviewee Mary Macaulay spoke to a need for transportation to medical services in Truro. However, the Colchester Transportation Cooperative Limited currently serves the community for just that purpose and offers financial subsidies for transportation. Our macro interventions help the community communicate current and potential solutions and resources to help deal with the healthcare crisis. Neighborhood change and empowerment is a process of discovery and action. Both systems theory and empowerment theory enabled our group to discover how problems from outside the community create issues for the village, such as administrative challenges of transferring physicians' medical licenses and challenges associated with physician burnout. These theories served as a starting point for framing two macro interventions and moved us from discovery into a process of suggested macro actions. We believe our macro interventions can support the community of Tatamagouche in ways which build capacity and strengthen the internal factors already existing within the community. Thank you for participating in our presentation, and we are eager to hear what you think. On the following slide, you will see our discussion questions, which we created to further explore the issues impacting the village of Tatamagouche. Based on your knowledge of promoting community change, what do you think can be done? Our discussions will be facilitated on November 23rd. We look forward to engaging with you.